Yesterday, I told you about the lack of mental health help in our county and state, but the reality is it's our young people in particular who some say are suffering the most. This tattoo on 21-year-old Lauren Kahn's arm is a constant reminder it wasn't too long ago that she was in a dark place.
It says you never need to apologize for how you chose to survive.
The quote from a poem that now covers scars from cutting herself.
I got it over the scars on my arm to remind myself that it's not something I need to apologize for or be ashamed of.
For Kahn, surviving her teen years and the transition between middle school and high school was difficult.
I was 14 when the depression got bad, and it was within that same year that the self-harm started, and then I think I was 15 when the eating disorder really came into play.
But at 18, Kahn says she hit her lowest point when she was raped. It was then that she realized she needed help. She got it at Kairos, a Grants Pass organization that helps teens and young adults living with mental illness.
Had quite a long stay.
But not everyone is so fortunate to get mental health help, specifically tailored for youth.
It's really a grave situation right now for children and adolescents.
Rogue Regional Medical Center psychiatrist Ann O'Connell says the psych unit at RRMC that's typically used for people in a mental health crisis is not an ideal place to treat young people, as it can be traumatic.
You know, police are coming in with violent and agitated patients. The only acute psychiatric inpatient facilities for children and adolescents are both up in Portland.
A lack of services for children, but also young adults.
The population that has probably been the least served locally, statewide, and nationally is young adults.
Bob Lieberman, the CEO of Kairos, runs facilities in Grants Pass.
The adult system isn't attuned to the developmental needs of people who, in many ways, are still in late adolescence.
He says statewide there are less than 100 high-end psychiatric beds for kids under 18, and it's worse when it comes to intensive beds in secure facilities for severely troubled young adults ages 17 to 24.
For young adults at this level of care, there's 12.
According to Lieberman, only a dozen for the entire state of Oregon. And Lieberman says all of those beds are at 3 Bridges in Grants Pass, run by Kairos, a one-of-a-kind program in the country. The same program where Kahn found the help she needed.
They use a more strengths-based and trauma-informed approach, and a lot of programs it's like they're just pointing out everything that's wrong with you and everything you need to change.
And while she says she's proud of how far she's come, she still has moments where she struggles.
I mean, I'm not going to lie and say every day is easy or I'm happy all the time, because that's just not how it is. I definitely still struggle with anxiety and some mild depression, but I've learned how to manage that.
Now she just wants to help others and show them that if she can make it, they can too.
I just think it's important to, with all the bad times I've had in my life, to turn that into something good.
Trying to inspire young people living with mental illness to get help that, while difficult to find, is still out there. Lauren Kahn and Rogue Regional Psychiatrist Ann O'Connell agree there needs to be more prevention efforts in schools and the community. But Bob Lieberman, CEO of Kairos, says there are some big plans in the works with new programs for teens and young adults on the horizon. I'll tell you more about what's being done to help people struggling with mental illness in part 3 of my series. That's coming up tomorrow. In the studio, Christine Pitawanich, NBC5 News.